Good morning, everyone. If it's too loud, let me know. My name's Angelo. I'm a urologist in private practice. Thank you for the opportunity to present today. So, if I get a bit mobile and from 3G go to 5G, please forgive me. I enjoy walking around and presenting. If you get a mention, your company or any company in particular, by no means is an endorsement at all. I've tried to contextualize the talk to show you what happens from a clinician and patient perspective. I am a urologist. There's certain terminology that we do use. I hope not to offend anyone. I do apologize. And let's go for it. So I'm a urologist. I was fortunate enough to do the MBA the last 2 years. That's one of the facilities I work at, Life Fourways Hospital. That's one of the other facilities, Netcare Olivedale. One of the other facilities, which is one of the innovations within healthcare, which is the day clinic space, and that's Cure Day Clinic. And my fourth building is my S9. Who's got a smartphone here? If you can put your hands up, please. So I think that's everyone. So that just shows you how things are going. In the day, I'm a urologist. And at night, get involved in healthcare technology. So you've all got a questionnaire. If you can please complete it later during lunch. It's a questionnaire from Hans Rosling's book, Factfulness. And it's important because there's so many positive things in this world. We always hear the negative. And by only understanding the essentials, can we then proceed to go ahead with adapting technology. And what he does is he's got these spheres, these 4 levels. And you can see here, okay, the pointer's not working, but level 1 to level 2, it's from $2 to $8 a day. And then you go to level 3, you're earning an income of more than $16. And then level 4 is $32. So if you have a look at level 1, sleep on the floor. If you're lucky, you have porridge. That's how you cook. Transportation is purely by foot. And then drinking water is a problem. You might go where there's no fresh running water too. It was alluded earlier. Now let's say you do well, you go to level 2. All of a sudden you have a bicycle. You can ride 20 kilometers to get some water. But should something happen to you and you get sick, all of a sudden you've got to sell your bicycle and you drop down to level 1. So that's just some perspective in terms of the challenges we face. So technology is an important tool. It's an enabler. But you also need to contextualize and see what the needs are. This is another slide, and it's Gapminder.org, also from Hans Rosling. And what it does is its lifespan in years and GDP in US dollars. If you have a look, the top, the yellow is Europe, the green is the Americas, the pink is Asia, the big one at the top is China, and the one at the bottom is India, and the blue is Africa. And I don't have a pointer here, but what you see in the bottom right is that in general, these are generalizations, all the data together, is people in better incomes don't really die young, and those who have less income don't really live as long as those that have cash. And that's interesting. So let's do a quick health check. So this is what's available at the moment, and these are tools that we're actively using. The top, on your phones, you can get blood pressure, heart rate monitoring, pregnancy test, ear sensors. This one in the bottom right is a Euroflow. That's important to the urologists. How fast you can wee. True story. You want to wee more than 15 milliliters per second. So it's just something you need to know for the guys. So we measure that. That's data. It's a sensor to check your heart rate. The bottom is how we're using X-ray technology, which we'll get to later. Sperm test. The one on the bottom left is a pathologist Lancet. So that's important. When we consult with patients, we give them an opportunity when they do their blood tests to get an app, so that when the results are then obtained, they can see their own results. So education is important in healthcare. You know, patients need to take responsibility for their own healthcare. So by allowing them to get these apps, they can then take charge of their health. Lucien England, at one of the HEMS conferences, says we need to move and change from bricks to bytes, hospital to home, from hospital to phone. So this is what happens in the current setup. You get sick, you get in the car, you Uber, transport, you go to the waiting room, but the waiting room doesn't look like that. It looks something like that. And the doc's not bothered, you know, he's busy, she's busy. And this is what the current system looks like. And what you'll see is you'll probably struggle to see the patient. And the patient's at the bottom there, bottom left. state, government hospital here, pockets of excellence everywhere, clinicians waiting. How do you bring everything together? So in my own practice, in terms of which medication works best, simple tool and all these other things we can use to collect data is in terms of alcohol. So you'll see a patient, you'll say, how many drinks do you have a day? And they'll say 5 a day. And say, sure, that's a lot. 5 times 7 is 35 for the week, times by 4, let's keep it simple, 120, times by 12, that's 1,400 drinks a year. So patients are aware of the data. You times that by 20, and all of a sudden, it's a big amount of money that they're spending, never mind the health benefit. So patients are aware of the data. They can make better decisions. In urology, size does matter, size of the prostate. That's the prostate there. Cancer detection, taken significant strides with technology. What we're doing now, we're biopsying with fusion techniques. We use fancy MRIs with real-time sonographic imaging to better identify the cancer so we can make better decisions. And by assessing patients, we can then decide if they need something like robotic surgery or brachytherapy for their cancer if it needs to be treated, and discuss the implications for the patient. But what's important is we need our own data. So clinicians should not record the data, for example, from Cleveland Clinic, but they should reflect on their own data so the patient in front understands what it's about. So quality and safety is important. Earlier was alluded to in terms of industrial revolution. Today we're in the fourth digitalization revolution, but we're heading towards the future, which is personalization. And these next 2 slides are from a syndicate assignment from last year, but they incorporate everything well, and it just shows how everything fits in terms of having electronic health records, implanting sensors, and using all the technology to link it together, including telemedicine. It's another slide depicting the same thing. So in terms of South Africa, I had to find some data that reflects our own context, our own circumstances, to see what we can do. And what's been looking out for now is the value measure. And what it means by that is we're driven towards value-based healthcare. So not pure volume, but what are the patient outcomes? What can we record together with data to make sure we get the best treatment for the patient at the best price? That's what we're here for. And what's important is the value-based healthcare is access is important, measuring the outcomes, and we need data to do that. Instead of saying, all the patients do well with an operation. You need to clarify that data from your side. Cost, healthcare practitioner satisfaction, and the experience of the populations they serve. So the metrics available, I'll look at the South African figures now in terms of the value measure, but the data states, we need to collect the data. And what's critical, we'll look at some stuff now, is electronic health records, because that's when data gets collected and it can be shared. And then wearables. Some of us have got smartwatches looking at the details and other devices coming through. They can check heart rate, monitors, etc. But with that data is the analytics. And this is where the machine learning and all that other technology comes into play as well. In terms of care delivery, what opportunities does telehealth offer, which we'll discuss? Diagnostic and treatment solutions. So if you have a look here, this is the first X-ray by William Röntgen ever recorded on your left-hand side in 1895. And this is the current technology we can do today with something called PET-CT scanning. And how do we use that technology to make sure that we get the best treatment for our patient by minimizing side effects and minimizing costs? But with technology comes the infrastructure. And South Africa, that's important in terms of internet penetration, service per capita. How mobile is our speed? How can we improve it for access? Do we need to use 3G, 4G, 5G? Or do we use USSD, which I'll allude to in a slide? And regulation. How do we police to make sure that things are done properly so that things are not done, how can I say, systems are not implemented for profit alone, but for true value for our patients? In terms of the South African side, you have a look at the value measure in the study, and you look at the South African average there. So we're looking at 29 for access, below the 16 country average, which includes African, European countries, and Asia. Satisfaction, 39 versus 52, and we're not as efficient as we need to be. Another concern for South Africa is the lack of healthcare providers, healthcare practitioners. So generally, we got 60 per 10,000 for our population. The average is 109. So healthcare integration and technology is key, and 75% of the population want it, and 83% of healthcare professionals, but is it really integrated? And the study said no, 27% of population and 15% of healthcare practitioners. And the money we're spending, the expenditure per capita on telehealth in South Africa is $4.7 versus 25, so it is undercapitalized. In terms of South Africa, we need electronic health records, and we'll allude to that now. We need infrastructural and educational improvements to support the implementation. There's this Amazonian e-commerce effect where the consumers, the patients are driving. They want healthcare now in the comfort of their home, on a couch. But how do we balance that with regulated and good healthcare? In terms of healthcare providers to drive adoption, can we look at alternative reimbursement models, different way of funding healthcare, and then acquiring data thereof to assess the different funding models? And that's got to be driven by a mixture of clinicians and hospital groups. Can the payers themselves drive their adoption? Can they use behavioral economics to try and encourage clinicians and patients to seek health in a certain way without taking any risk? In terms of data analytics, what's important, the data coming through, is the younger consumers are more likely to use technology, but it's 47% in 55 plus, which is interesting. Patients are more trusting with their technology with regards to healthcare and banking as opposed to other industries. There is a lack of understanding how these programs can be implemented and how they can work. Wearables is significant. We've got 0.02 wearables in terms of number of users per capita in South Africa, which is half the global average. And the market size for wearables is $0.62 per capita versus 6.3 for the rest. But key to this is getting the data as electronic health records. And that's really, really important. And how do we integrate these electronic health records into the national health system within South Africa, as well as insurance system? And how do we transform healthcare to get it where we want it to be? In 2019, you can see a quote here by Cecilia Annam: patient-centered integrated healthcare services should not be about cost effectiveness and efficiency, but a response to clear patient needs and outcomes. So we also need to define the need, and that's where electronic health records are important, because we can have data that we can analyze and build the system also according to that. Just briefly here, you can see we've taken South Africa versus the UK. You can see our GDP per capita there. Our healthcare spend per capita, $470 versus $4,300. And you look at our life expectancy, which has improved of late because of the significant strides we've had in fighting HIV and AIDS. It's gone up to 63 versus the life expectancy of 81. You can see a concern is the infant mortality rate, which is 28, almost 29 per thousand births compared to 3.7, and that is improving. And if you have a look and compare our output, it's 8.2 healthcare spend per GDP versus the UK's of 9.9, which is similar to the average of 8.4. But if you look at our outcomes and our efficiency ratios, they're well below what we should be, and it's opportunity to improve, and I think technology can do that. So in terms of South Africa, there's two health summits. One is a presidential health summit, and the second is our mHealth strategy document. That's our ex-health minister, Dr. Aaron Motsoaledi, and now we've got Dr. Zweli Mkhize, and hopefully together we can engage all the stakeholders and not work as silos, but together come up with a model that works for South Africa. In our digital health strategy, what's important is there were 42 systems there, but there was no integrated electronic health record system. And that's important. If we do not communicate together and get all stakeholders to engage, we will not see the difference that we want to see. It's clinicians and our patients and our family members, and that's important. In terms of the mHealth strategy, what's interesting, it expires announced the 2019 documents. I'm sure there'll be a new document coming out, but I'll show you there's a program there called Mom Connect and Nurse Connect. So what it does is once a pregnancy is confirmed at a clinic, the nurse will register that patient on their phone using USSD. Then what happens is any questions and stuff, there can be communication with the patient with regards to their pregnancy, and there'll be messages that are sent out throughout the pregnancy every week. And ideally, they capture a national database. And that's important because earlier I mentioned in terms of the infant mortality rate and the maternal mortality rate, which I didn't discuss, it's the number of moms that actually died during the childbirth process, which is far too high in South Africa, and that's where we need to make a tangible difference here. Now, I'm going to Australia's digital health strategy because it's very interesting to see what they're doing, because it's important to also look outside. And what they're going for is a My Health digital record. And every Australian has a right to a My Health digital record, which they can delete should they wish so. At the moment, I think they've got 20% coverage of Australia. And if you look at their strategic outcomes, I'll put them all up there. Is health information available whenever, wherever? Doesn't matter which clinician you go to. It could be your local GP, it can be the specialist. Health information exchange securely. Let's say you're a prostate cancer patient and you want multidisciplinary access. Your oncologist can see it, the urologist can see it, radiation can see it, physiotherapist, physician, etc. High quality data that's commonly understood. better availability to access prescriptions. So often I'll get phone calls to urology practice. So-and-so says you must call him. Like, all right, what for? For the script. I'm like, which script? No, he wouldn't say. Now, urologists prescribe two things. The one is Flomax to maximize the flow, and the other one is with a capital V. So patients, if they're uncomfortable dealing with the front desk, they could just log on. You could send the prescription, which is fine, as long as you see with a reasonable amount of time. So digitally enabled models of care, that's alternative reimbursement models, and workforce needs to be trained to confidently use technology, because that's a big factor. And then a thriving digital industry, which we can all work together and create our own ecosystem so we're all on the same page for the benefit of the patients. So if you have a look at it here, they basically mapped it out, and you'll see it's from pre-birth, antenatal, up until the end of life. So you can have a look up top there. The average wait day, 3 to 6 days to see a GP, and you can do a same-day online consultation in the form of telemed or an online consult. If you have a look and see, sometimes patients will not, how can I say, if you look at the top one, the 11% of women miss their contraception pills, but you drop down, if it's a script online, that doesn't happen. And the benefit goes throughout, and there's cost savings that can be done, and this is a strategy that everyone's bought into, and all together can make it happen. So if you look general in terms of healthcare, in terms of the electronic health record adoption model, in Europe it's still low, and the US it's 35%. There are lots of digital health strategies throughout. One of the ones we just discussed is in Australia. And here's Healthcare Information Management System Societies. It's a non-profit, and they promote the use of IT and management systems within healthcare. What's interesting, one of the talks here was by Anthony Chang. He's a medical doctor, he's a cardiologist. He's working at the Chock Children's Foundation. And basically, his talk was the fact that technology will not lead to replacement of the clinician. So the routine work might be covered by machine learning, algorithms, etc. But the more complex stuff, that's cognitive work, complex manual tasks, will not. And the idea was in terms of radiology. So if you have a look, for example, that's when you're looking through an ophthalmoscope in a patient's eye, and let's say, for example, during a clinician's lifetime, they may see 50,000 images. With machine learning, they can maybe see 15,000 images within a few minutes. So the routine stuff, there's definitely an opportunity to work together. Here, what they basically, the slide I want to show is familiarity with blockchain technology. And you can see in the bottom left, in terms of the healthcare facility, is the clinicians and those who work within healthcare are very unfamiliar. They're below the average as opposed to the consultants, software vendors. Here they've scored the governmental health authorities quite high. The perception is it might be a little bit lower here as well. And once again, if you have a look at the barriers and the concerns, if you look at number 6, lack of trust, 7, security threats, high costs. They were not the issues. It was more the top, which is lack of in-house skills, insufficient user knowledge, etc. So a lot of education is important with these technologies, not like you can implement and they're ready to go. And if you have a look and they ask the same trial and they see which companies were known, and 76% did not know any blockchain vendor. And out of a cohort of 322 patients, the highest scoring was for IBM, but only 22. If you have a look here, the expected year, and once again, predictions are always wrong, as alluded by your talk earlier, they reckon that by 2023, 58% of European countries will have an electronic health record system in place, with Germany and Holland by 2024. So just a spoonful of telemedicine or digital health or virtual care can help the medicine, and maybe we can turn our Mary Poppins into a super Mary Poppins. But what's important is to understand the regulatory environment. And this is where it currently stands at the moment. This is very important, is for a telemedicine consultation online, there needs to be a requesting patient, a consulting healthcare practitioner, a servicing healthcare practitioner, and it has to be a follow-up consultation only. So at the moment in South Africa, one cannot go online, choose a doctor, and have a discussion. Okay, so it's very important to understand that's only for follow-up consultation, and there's significant acts we need to be wary of, Consumer Protection Act, the POPI Act, etc. So it's still a very regulated space, so we've got to be innovative within these boundaries. But telemed has got an opportunity to embrace the patient, clinician, and technology as long as we use the regulatory framework. And it's important because almost like customers want online banking, online shopping, you can get online health as long as it's done correctly. Now, what it can be used for is you can describe your symptoms, you can chat with the doc. New consultations are not allowed, but you can do a follow-up consultation, you get a diagnosis or prescription. You can charge for it, but what happens now in clinical practice is you see a patient, discuss the results, you'll phone them, and you don't charge for that. So to add an extra layer, so the system's got to be looked at in a different way. It's not for emergencies, for certain scheduled drugs. Benefits can keep patients compliant, education is important, it can keep them engaged, and sometimes a family consultation at home, you're dealing with a complex oncology case, can be of value. In the US, there are lots of companies that are doing telemedicine, MD Live, Maple in Canada, and you can see a doctor online straight away, $35 for a consultation, add a script, $45, and they cover acute care, sort of emergencies, chronic care, your diabetic meds, mental health, which is a big trend now at the moment, and then women and men's health.